can see that we flattened the curve. Everything that you all did helped to flatten the curve, and our cases are just coming in a few every day. There's this phase risk indicator tab, which shows what's happening in the last 14 days. So currently, there's 6 hospitalizations from COVID instead of the cumulative number, which is on our main page. And I just wanted to point out here, this graph, the blue bars and the yellow line, it just shows that we have plateaued over the last few weeks. And that's one of the signs that helps us know it's okay to be in yellow. But other things that we're monitoring are the number of people in ICU beds in the hospitals, and then how our testing is going. So this is available to you. And while we have really good news in that our cases are going down and we've got a ton of testing in Davis County, we are seeing some of our outbreaks in work sites. It's a very common place for people to be exposed, and we've had many outbreaks in food establishments, manufacturing settings, and in healthcare settings. So we just want you to be thinking about this guidance, knowing that while we flatten the curve, that's a good thing. So we're not going to have a huge explosion of cases all at once, but those cases are going to be spread out over time. And so that we know over the next few weeks and the next few months, people are going to be infected, they are going to test positive, and your business will very likely be affected by COVID-19. And so just as you're hearing this information, you can be thinking about preparing for absenteeism, what may happen if someone tested positive in your work site, and having those continuity of operation plans so that you would know what to do if a few people had to be excluded from work. Okay. So these are some of the signs that are available to help. If you guys, you can print them from our website, but we can also print some and deliver some. So let us know if you need signage. There's hand washing, social distancing, face coverings, all of the key messages. So why do we have the phased guidelines from the state? This Utah Leads Together plan is to help businesses and individuals balance health and the economy. It's so hard that everybody's been affected by this. Pandemics affect the economy, unfortunately, but the state has a very progressive plan to help get us moving as quick as possible. And there's many stakeholders involved in putting these guidelines together, including all the industries and health professionals. And then this is just how we can help respond to the plan the most effectively. So what does it mean that we've moved to yellow? There's just a couple of things. It's not a huge difference from orange, which we were only in for 2 weeks. And honestly, we can't predict when we're going to be in green, but a lot of people want to get to green as soon as possible. And hopefully our data will keep looking good and our community will respond well. But overall in yellow, we still need to take precautions and maintain social distancing in public settings, wear a face covering when it's difficult to maintain social distancing. Gatherings are up to 50 individuals during this phase, but really smaller groups are preferred. And these are for kind of private gatherings, family gatherings. In business settings or other settings where there's an organization who's kind of managing the event, there can be more than 50, but they just have to ensure social distancing and show that they kind of have a plan to keep everybody safe. So that could be a religious organization or a business setting where they can have more than 50. It's just practice those precautions and have a plan. Still limiting travel is important. And then symptom checking before engaging in close contact. So that's people who are working closely together. That's in sport settings. It's important to just not have people who are sick come to work or participate in sports. And really high-risk individuals are important to keep in mind because this is still a very risky time for them. And we need to have kind of special precautions in place for all of those who are in the high-risk category. And Rochelle will go into more detail about some of these specifics for your industry. I'll turn it over to her.
Hi, everyone. Again, my name is Rochelle Blackham, and I'm the Environmental Health Service Director. Just give me 2 seconds while I share my screen. Me and Isa are practicing social distancing. So we are in our individual offices. Okay. So first, what I'd like to go through is just the Utah Leads Together 2.0 phased guidelines. So this is a link to the website where you can get the most up-to-date guidance, which I do have to say it has been changing frequently, and so it's been difficult for us, as I'm sure it's been difficult for you. What we've tried to do with the summary oversheets that Isa showed on the website is combined all general business guidelines as well as industry specific onto one page. So that's what we've been emailing out, which we have not emailed out the low risk, which is the yellow category, but we will get to that today or tomorrow. And of course, it's available on our website. As we go through these, I want to just point out that the general business guidelines are split up also in different pages or sections within this guidance. So I just noted here that it's page 2, 5, 10, and 20 that we're going to overview. So first off, this is kind of my plan, is to go through these different items. So first off, take reasonable precautions. So I do want to say that as we review the bans by different industries, they really truly are case by case, and every situation is different, and you guys are going to know what best fits your practice. And so I just want to encourage all of you to take reasonable precautions, and it is going to be specific on your business. So encourage remote working, we're going to go through that. Symptom screening, we're also going to go through social distancing, strict hygiene, cleaning and disinfecting, mask use, protecting high-risk individuals, other practices, and then we will get into the specifics for just restaurants. So first off, it is still preferred to encourage remote work. So you can see the sign that we have available to promote that. We also not only are promoting remote work, but encouraging flexible working arrangements. This could include telework, but in a restaurant, we realize that that probably will not. So this is going to come down to rotating shifts. I would say limiting the number of intermingling of groups. So if you have a set crew that does the morning work, try not to have employees work the morning shift and night shift. Really try to keep them in groups. That will help when it comes to possibly exclusions from work, which we'll get into. Exercise discretion when returning to work. Again, you may have heard that we're trying to use more of a dimmer switch approach as we've moved from red to orange to yellow or high all the way down to low risk. We want individuals to ease into this and not just flip the switch and have everyone return to work. So as you return to work, just practice, put in place different policies that protect your employees and your business. And again, just encourage emails and phone calls, possibly when you have deliveries or paying invoices and things like that. Try to do that electronically. So symptom screening has been a big question for us. So we have quite a few slides on this, but you're going to want to monitor your employees for symptoms. If an employee becomes sick while they are at work, you should not only separate them from everyone else, send them home immediately, but also sanitize the workstation that they were working on to prevent the spread of the COVID-19. And then I am going to get into the exclusion letter, but prohibit employees who have been instructed to quarantine and or isolate. And we will give a letter to you if you're the manager at the facility, but we will let the facility know who is restricted from working. So a symptom questionnaire and log. This is also a sign that we have available on our website, and it just helps you how to take your temperature. This particular one encourages individuals to take their temperature at home and then check for the following symptoms and assess any exposure. So overall, I think it's a good guidance, but you are going to monitor your employees again for symptoms, and those include fever of 100.4 degrees or above, a cough, trouble breathing, a sore throat, sudden change in taste or smell, and muscle aches or pains. We've had a lot of questions from all industries on how do I do that? What do I need to do? So we're not dictating how you need to do it. It can be a verbal checklist, or it can be through verbal, or it can be a checklist. It's up to you how you track and monitor it. You should have logs available to the health department. So if I were a restaurant manager, as people at the beginning of their shift, I could, as the manager, have a check box, and I would say, do you have any of these symptoms? No. I mark that Joe had no symptoms at this time on this date, and he, I did that verbally with him, and that would be a good example. What I do want to make sure to point out here is that you wouldn't want to have like a common use pin that everybody signs in or touches, or the clipboard gets passed around. Obviously, we want to eliminate those common touched items. So we would encourage each employee to carry their own pin, have their own log and clipboard, and or have a manager do that. But that is up to you. As far as industry specifics, if you are a restaurant, which you are, or a gym, you are required to take employee temperatures before shifts. And again, it's at 104 or higher, and they should not be allowed into the establishment. The next question here that we have a bullet point on is what thermometer is available, and how, what thermometer can we use? We understand that industries have a difficult time getting list thermometers, but I want to go through that we are encouraging you to use contactless, and your IR or infrared probe thermometers, or some of the probe thermometers have the IR feature, or the infrared contactless trigger thermometers can be used, but they're not calibrated for human temperature taking. And so you're going to want to point it exactly at the forehead, because it's going to be taking a temperature in a 1-inch radius. And then the approved temperature for those thermometers is 90 degrees to 94 degrees. One of the common manufacturers for these types of equipment is ThermoWorks, and you can find that information on their website. Again, if you cannot get one right now, at a minimum, please ask your employees to take their temps right before their shift. Obviously, it says that they're asking you to purchase a thermometer and use the food grade if you need to, and that should be adequate for a screening tool. So want to talk about what happens, or what it means to be exposed to the COVID-19 virus, and what it means to be quarantined. So if someone is exposed because they worked with somebody else that was sick and then turned out to be positive, then they should quarantine themselves for 14 days. Let's say you have a food worker or an employee who becomes sick. Anyone who was within 6 feet of them for longer than 10 minutes and did not have on, in this case, a mask comes into play a little bit if both individuals were wearing a mask. But if they were not wearing a mask and they were within 6 feet again for longer than 10 minutes, then we would say that they were exposed, and they need to self-quarantine for 14 days. And they must complete that 14-day quarantine, because that's how long it takes for individuals to become symptomatic or become sick. So I know some people have had some confusion. Well, I was told I was exposed, so I went and was tested, and this is 5 days later, my test is negative. You still will need to self-quarantine for that 14 days. So again, if you test positive for COVID-19, then this talks about when you can return back to work. So you can return back to work 3 days after you are fever-free or have improved symptoms, but that must be at least 10 days after you first became sick. If you are asymptomatic, which I know some of you are hearing that people are positive but they've never been sick, then from the moment that you get a positive test result, you must then self-isolate yourself for 10 days after the positive test. Hopefully that makes sense. And I'm going to kind of talk about this slide. This is an exclusion letter. So this is what you would expect to see from us if one of your employees did become sick. We would Through our contact tracing efforts, we would determine that the individual worked at like ABC restaurant. This is the example we're using today. And we would ask you for their shifts. We would want to look at the schedule and look at who worked with that individual from when they became sick to 7 days prior from when they were sick. So we're going to be asking for the schedules for your facility, and then we want to know what the workstations look like. Are the workstations all 6 feet apart, which we'll get into throughout this presentation. And then in addition to that, does everyone in there wear a mask? That can help with preventing exclusions from work. We obviously highly recommend 6 feet distancing and mask use, because then you won't need to quarantine your employees. But I understand that in a lot of restaurants, you're in close spaces, whether that's at the drive-through or just in back of your restaurant, line cook, things like that. Sometimes it's not practical. So as you can see, after we look at the schedule, we will see who was reasonably around the sick individual for longer than 10 minutes and closer than 6 feet. And we will show you who of your other employees may not return back to work. And we'll give you a date on when they cannot return back to work. So back to the social distance, we want people to still maintain 6 feet distance from each other. So again, that comes back to staggering workstations if possible. And it does make a difference with not facing each other. I know if you're working on the same prep table that you may be facing each other, but we would actually prefer you guys to stand facing the same direction on the same table than facing each other. That's just because then that's a direct route if someone were to cough or to sneeze. We want to limit employee to employee contact as much as possible, depending on what's practical in your business, and then minimize customer interactions and or time spent in your facility. And of course, limit group sizes when possible as well, which we will get into more specific details on how many people can be seated at a table as we move through this. So strict hygiene, this is one thing that I really feel like the restaurant industry already knows what they're, this is something that you guys practice every day, but frequent hand washing, making hand sanitizer and soap readily available, avoid touching your face, use best practice when you're coughing or sneezing into your elbow like this, and then do not shake hands. Again, cleaning and disinfectant, we feel like the restaurant industry knows pretty much what they're doing here. We want you to regularly clean and sanitize the facility as normal, but we want you to increase cleaning on high touch surfaces. So switch out your serving utensils as much as you can between people, shifts, more than what the food code requires. And then obviously have your sanitizing buckets, check those regularly, make sure they're at the appropriate concentration. You can use quat and or chlorine. And we really encourage you to increase sanitizing. And then of course, I already mentioned this, but please immediately clean and disinfect a workstation or area if an employee is sick. And don't forget about the surfaces that customers may be touching, whether that's opening the door to enter the facility or leave the facility. We would encourage a hostess to be there to open that to eliminate those high touch surfaces. So mask and face coverings. This has been a big one as well on questions. So they should be worn by employees and patrons when it is difficult or impossible to maintain 6 feet distancing from each other. We do believe that it may prevent the spread of virus from the wearer to others. And this is important and comes into play with the asymptomatic spread, those individuals who are testing positive that didn't even know they were sick. That's why we're encouraging mask use. And we'll get into the specifics again in a restaurant, but wearing one, I think, adds additional public health measures. And it doesn't necessarily replace hand washing or social distancing. Just because we have a mask on doesn't mean we should all come together in the restaurant, but we're encouraging you to wear a mask if you cannot maintain 6 feet distancing. Again, it says use clean face coverings, and they should be washed daily. You can see in the picture that some people are using bandanas, some people are using homemade masks. These are all acceptable. Please just make sure that they're getting cleaned and maintained. Again, we want to make sure that it's clear that children under the age of 2, it's not recommended for them to use a mask. So individuals who cannot remove the mask themselves, it's not encouraged for them to wear a mask. But other than that, just make sure you can breathe through it and wear it. Make sure it covers both your nose and mouth, and wear it in public settings. So requests for PPE, we understand that there are businesses out there that need help getting their hands on this personal protective equipment, including hand sanitizer, gloves, whatever it may be. So there is assistance through this. And in some of these items, please act the number listed here. And you asked if you call the number, so you could just say clicking on the link. The link here actually has you do an assessment, as well as it's an order form. So it's going to ask you about your business, how much you work there, how much you have on hand, forward to then figuring out how long we had used some items. So when to wear a face covering. So face coverings in restaurant settings should be worn by employees and patrons when they are, excuse me, that makes perfect sense. We're going to be seated at, so you would need us there. We're in the still be interacting with a customer to some extent. In the back of the restaurant and in 6 feet distancing at all times, you would not need to wear a mask. But obviously, we're going to recommend you wear a mask because it helps when somebody does become sick. And unfortunately, we already have had several cases in Davis County where we've issued exclusion letters to restaurant owners. It's just unfortunate, but that's just the way it is. It does say that face coverable, so I understand that puts a little bit of a heavy load onto the employers or business that resources are available. So high-risk individuals, if they work for you, we're asking for remote work when possible, and then staggering shifts when possible, minimizing face-to-face contact, and trying to keep that is where they're from other individuals. In the dine-in section, it does high-risk individuals to still, it does recommend still takeout only. And then this yellow part of the slide talks about individuals who are considered high risk. So I'm not going to go through all of them, but it does include, chronic illnesses, individuals who are over the age of 65, and people who actually live in a nursing home or long-term care facilities. Unfortunately, this disease has a large impact on those high-risk individuals, and that's what we're seeing. So other practices, just to briefly go over them, like avoid handshaking or unnecessary physical contact. Consider practices that protect the employees, like countless pay options, putting up partitions at where you would interface with the customer, having non-punitive leave policies. If individuals aren't scared to call in sick, then they're less likely to come to the facility sick. Again, propping door opens during deliveries and or when people are entering and leaving the facility to eliminate high contact surfaces. Again, limit unnecessary if that's something that your company does, and follow the CDC guidance. There are areas that are considered high risk, and when people return from a high risk area, the guidance is recommending that they quarantine for 14 days. So I want to get into specifics just for restaurants to make sure we're all on the page. So dine-in services and bars are open in this low-risk category. You should arrange tables so there is appropriate distance between the diners, and I'll do a little bit more on that. But you should also have increased hygiene practices for customers and staff. So that's going to include your symptom screening, as well as your mask use, as well as your distancing within the facility, and your increase in sanitizing your high-touch surfaces, rotating out the in-use utensils, different things like that. There is an entire appendix. It's called Appendix A. That's guidance for dine-in restaurants. It's page 20. I highly recommend everyone to read every single part of it, but I am going to briefly go over it at this time. So, number one, this section is page 11 of the guidance. So you have the appendix on page 20, and you also have page 11, which is the section on restaurants. So for takeout services, again, symptom checking of your employees. We already talked about that. However you choose to do that, you should be actively asking about temperature and taking temperatures. Staff wear face coverings. Highly recommended. The only time you would not need to wear one is if you could maintain social distancing in a very large facility. Staggering workstations so you can maintain that social distancing, and then making sure you don't have people face to face. Encouraging contactless payment. This one is, I understand, is going to be very difficult for drive-throughs. So if you do not have contactless payments, you would need to disinfect between transactions and before touching food. So I've seen a lot of restaurants, that are able to reach the remote outside the window, and then the customer does their own payment. I would highly encourage something like that, because you guys will go through sanitizer, glove use, and all those things like crazy as you're at your drive-through window, if not. And then customers voluntarily provide contact information. This is something I haven't seen anyone do yet, because we're moving to this low risk. But as we move forward, if we have a case or someone who becomes symptomatic at a restaurant, what we're hoping to be able to do, if it was a customer, we're hoping that they knew who they sat next to. They know who's in the group. At that point, that the facility maintained distance between tables, and so then we would not feel like there was an exposure other than anyone at that table. But if for some reason you did like a larger party or a large group setting for some reason, then we would obviously ask you guys to provide contact information. And that might be maybe a country club or something like that for a wedding or a funeral, because all restaurants are not the same shape and size, right? So I'm talking mainly to the caterers and event coordinators there, asking those individuals to provide contact information because you did not maintain distance or you had a larger group. Again, on signage, these are just signs that are available. I want you to see the one about the symptom check, because in Appendix A, it does say it's recommended upon entry that a host points to a signage similar to this and outlines the symptoms and encourages patrons who have these symptoms, or someone who may live with someone who has these symptoms, to please order takeout instead of coming into their facility. And then it also recommends high-risk individuals to proceed with takeout instead of dining in as well. So these resources are available to help you. This is the appendix referencing. It's page 20. I'm going to go through some highlights, but I highly recommend you guys looking at it. So you want to limit individuals at tables to groups of 10. And obviously, same household is still preferred. You want to maintain 6 feet of distance between the groups and or tables, and this includes in the waiting areas. They can still wait out in their car. You know, I know you guys have different techniques to maintain this distance in the waiting areas. You can also have signage reminders. ISO went over the 6-foot distancing signage. We would encourage you to have that posted to help with patrons following those rules. I talked about the host in encouraging takeout for individuals who are symptomatic or live with someone who has symptoms and or who is sick, as well as high-risk individuals. I briefly went over this already, but managers should check employees for symptoms. Staff should wear masks when interacting with customers, and again, when they cannot maintain 6 feet distancing. There should be no self-serve of cups, lids, napkins, or straws. So the employee needs to hand those to the customer. Avoid touching items that are placed on the tables. This one kind of goes with the next one, which is dedicate a staff member to sanitizing. So that's the busser. So I want you guys to picture this. I am a waiter and I go and I grab someone's cup, I fill it up, I touch the same surface that their hands touched, and then I go over to the next 4 or 5 tables that I'm in charge of and I touch all of their cup handles. Or cup, excuse me. So that is what we're trying to avoid. So obviously there's recommendations that are out there. Just get them an entirely new cup and don't clear their old cups until they're done eating. But this doesn't just go to, this doesn't just apply to cups. It can be menus, plates, silverware, all of those things. You guys are gonna need to come up with a really good plan, and then just have the bussing tables. Sorry, we have jets flying over. The next thing is to-go containers as well as cups and paper products should be treated like food items. And then indoor playgrounds are still to remain closed at this time. This is a resource that is available on our website that Isa kind of went over. It does talk about self-quarantining and self-isolating for positive individuals, encourages social distancing, as well as talks about screening of employees and keeping the establishment clean. The last thing on here I want to just talk about is just reminders when it comes to COVID-19. So we're still learning a lot about the virus and the causes of the virus. Currently, there is no vaccination or way to prevent. So obviously, we're encouraging social distancing and mask use and small group gatherings. The best way to prevent is not being exposed. Take precautions if you are in a high-risk population, and then individual responsibility. We are really, really encouraging / hoping that individuals who are sick just stay home and don't come infect the rest of us, obviously, as well as we're hoping, and we know that our partners like yourselves, restaurant owners, have the ability to make a difference, and we really encourage you guys to do that. At this time, I would like to point out that this is the contact information for the health departments. So as I mentioned, I am the division director for environmental health. The line listed there is our front desk for environmental health. I realize a lot of you probably have it through paying permits and different things like that, but all business questions can come to us. I've put the nurses line on here. As you can see the phone number there. This is for worksite exposures, positive cases, and quarantines. If somebody is sick, they have the results of that, and we work closely with them to create our exclusion letters. And then obviously ISO went through the content that's on our website, but wanted to give that to you. This is our logo, Davis County Safe, Smart, and Strong. We truly believe that you guys can help us in promoting that. And we have a couple more contacts listed here that I will turn the time over to Rob if he'd like to speak to these. And then I believe, oh, excuse me, that's for my next one. Then I believe, wow, struggling.
Perfect.
And I believe we're gonna move to a question and answer.
Yep.
There we go.
So yeah, so will you put that screen back up actually real quick? Sorry.
Can you see it, Rob?
Perfect, thank you. Yeah, so these are just a few of the contacts. So the first one, that's my direct number. So feel free to call that if you have any questions regarding financial assistance. I can help walk through some of the things that are available. Or just if you need to talk to somebody, feel free to reach out anytime. The second number is the Small Business Development Center. That's the thing I talked about earlier at the Davis Technical College. Andrew Willis is the director. That is his direct line. As part of the CARES Act, they actually received some increased funding to assist with more businesses. So that'd be a great number to call to for consulting and other things. And then the Commercial Rental Assistance Program, that is the direct link to that, where you can find out how to apply, the different steps to take. And then I mentioned the Northern Utah Economic Response Team, and that is the website to that link. So now it's question and answer time, but I don't see any questions yet. So maybe we'll give you guys a minute or two to write your questions. We have about 16 minutes still. So if there aren't any questions, Rochelle and I did a great job. So if there aren't any questions, then we can end early as well. I think there's also a raise hand option if you would prefer to do it that way too. Okay, so if no one's typing any questions, if someone has a question, you could quickly raise your hand real quick and I will not end it. But if so, we just want to thank everyone for tuning in. Hopefully this was helpful. And if you have any questions, feel free to reach out to me or reach out to any other panelists, and we'd be happy to help answer your questions during this time. And again, thank you everyone for listening, and please feel free to reach out to us. Have a great day. Thanks. Bye.